Thank you so much for joining me for this episode of the Wellness Ritual Podcast. Our goal here is to empower you with new wisdom, new understandings, new ways of showing up for your health and your vitality in this lifetime. Dr. Fiona Lovely is incredible. Follow her, check out her podcast, check out her website, drlovely.com, and share this episode with every single woman in your life. We're all going to go through the transition of perimenopause and menopause. So this wisdom applies to all of us as we approach our generations. And as we spoke about, post-menopause is the next 40% of your life. Maybe it's worth it to show up with some great tools and some great wisdom and some great knowledge to really support your health from a preventive standpoint. HRT is actually just one big tool in the toolkit around menopause, but there are so many others, and we didn't even get to approach those. So check out Dr. Lovely, check out my website at drshivani.com, where you'll find a lot of resources around inflammation health, wellness, women's health, and this topic that I'm pretty obsessed with. And I've had a lot of different amazing guests on the podcast in the last few years on these topics as well. So if you have any questions at all, I am in my Instagram, in my Facebook. I respond to DMs. It's a joy to get the honor of impacting around health and well-being. I teach all about Ayurveda as an approach to our health. So definitely reach out to me. I'm at dr.shivani Gupta on Instagram. I am drshivani.com as well. And then the sponsor of this podcast is fusionaryformulas.com. And there's a special code for you listeners. Fusionary Health will give you 15% off. So stay well, everybody. See you for the next episode. And I hope you got as much out of this episode as I did. Stay tuned for the next week. Welcome to the podcast, Dr. Lovely. I'm so excited to have you on here today and have this conversation. Welcome.
Yes, you're welcome. Thank you for inviting me. I know we have had previous vigorous and interesting conversations, so I expect today will be the same.
For sure. So we got to meet through so many friends that we share in common at A4M last year.
And
yep. It was so great to meet you. And then I got to be on your podcast and share about Ayurveda for the perimenopause, menopause crew. And this happens to be a topic of obsession for mine since I am 45 and in the middle of perimenopause. And when it did finally hit me, the symptoms at least at about 44, I was like, what is this? This is not fair. And we all need more awareness and tools. And then fast forward, I'm looking at my mom and her generation. And I keep saying, guys, you need a menopause specialist. Like, you aren't on HRT. No one's having an estrogen protective conversation with you. What's happening here? And all I hear is people say, you know what? My cholesterol's going up. My weight gain has gone up. I have weight around the middle. I don't know what to do. I am tired. My brain doesn't work. All these issues, and I'm not saying they're complaints. They're completely valid symptoms. And I would love to have this conversation to you today around menopause, because you're really one of the first people who came online and started actually talking about this. So let's kick off with what was that like, and what brought you into this space at the time that you got into it and created I think you have the first podcast ever on menopause.
Yes, as far as I'm aware, when I uploaded it to Apple Podcast in late 2015, early 2016, I was the only one. There was nobody else doing a menopause podcast. And so we're 10 years into that process at this point. I just recorded last night's episode, it's the 199th episode. So it's amazing to me. It's been such a cool journey. And when I started talking about menopause, it was a surprise to me just as much as it is now. I'm used to it now, some 20 years on, but I'm a chiropractor. That's my professional designation. But when I was a woman in my 20s, I had a gynecologist gaslight me. And what she said to me that day, I remember it so vividly. I knew with every fiber of my body that it wasn't true what she was saying. And now it took quite a while for science to show that what indeed my body knew was true, but my gynecologist did not. That science came years and years later. So when I was in professional school, I went about getting as much training on women's health that I could. I had to do that extracurricularly because there was some training within my chiropractic program, but not anywhere near what it should have been. And I really took that information to make sure I was never in a vulnerable spot with a medical professional again, who could tell me that something was true about my body when in fact I knew it wasn't. And that's why I took that training. Now, what I didn't expect was that as a young, new chiropractor, 30, I think it was 31, 32 maybe, the women would pull me in. They would pull me in. And because I was new in practice, so I had lots of time. When the women would ask me questions, I had a woman, the first patient that came to ask me these things was a woman in her 40s with a new child saying, these are all the symptoms I'm having, hot flashes, I can't sleep, I've got vaginal dryness, and I've got all of these things. And her doctor just said, well, she's postpartum. It's fine. You'll be fine. But I had the opportunity to tell her that it was something far different than that. And she was essentially patient zero. And that was 20 years ago. And so here I am. It was accidental, Dr. Gupta. But on the other hand, it probably was not accidental at all. Do you know what I mean?
I do. We learned so much from the people coming to us with questions. I had studied Ayurveda, did my PhD on turmeric, and then went forward thinking, I'm just going to build a turmeric company. I'm just going to change the world of turmeric. But what happened was people kept coming to me and saying, I have these symptoms. What do you think? And of course, my first tool, it's like hammer and nail. It's always turmeric first, because I'm like, well, turmeric can do that. But I also realized that the questions I was being asked were much deeper. In women's health, we are thankfully very open. We're like, hey, this is what I'm suffering from. My brain is not working. I said that clearly last year. I was like, something is wrong. I know the access and the data of my brain. When I can't access it, something is broken. Something's not working. And I got to fix that issue fast. And so it's women who came up to me after every single stage I spoke on for the last 10 years who said, do you have anything for menopause? And I was like, back then I was in my early 30s. And I was like, no. And what's the problem here? And of course, you fast forward in the ages and you're like, oh, okay. Whoa. We got to solve this one. This is an issue. But it's why I created Menopause Support Tea, Sleep Tea, because people kept saying, I'm not sleeping. I'm having hot flashes, night sweats. What do you have? And so from the Ayurvedic perspective, we first reach into our adaptogens. We're all about shatavari, ashwagandha, Brahmi, like these herbs are so powerful. And so in your case, when these women started coming up to you saying, I've got these symptoms, I think it's so wonderful that not only did you go to chiropractic school, but you said, you know what, I'm going to go dig deep and go find the coursework I need to start to help them. And then I'm sure the knowledge was so limited because in the integrative space, we have a ton of knowledge. We have a lot of the ancient wisdom, naturopathic understandings, homeopathic, Chinese medicine, Ayurvedic. We have those understandings, but we might not have even put language yet to the menopause conversation the way it stands. And in this moment, we know no one was taught it.
It's true. The word perimenopause didn't even exist at that point.
Yeah. Isn't that crazy?
So we were just saying premenopause is what we were saying.
Right.
That was the best thing that we could do. And so we've got a lot more language now. Thankfully, we've got a lot more science now. It's about dang time, to be honest. Yeah. And but there's still huge gaps. Like you mentioned the symptoms of cardiometabolic disease that comes with perimenopause. Those were the first three symptoms that you talked about today, which was the weight gain, the why am I putting on fat around the middle? There was the why am all of a sudden my cholesterol's high, etc. Well, there is a cardiometabolic shift that happens at menopause, and when it happens, it increases our risk of all-cause mortality across the board. And I was in the research on it this morning, doing some research for the metabolic health module for my menopause doulas. And I texted a girlfriend and I said, listen, I'm mad as hell. How is it that medicine has known about this cardiometabolic shift for women for decades, and there were not resources put towards it? It makes absolutely no sense to me. Please explain it. She's like, oh, you're fiery today. I'm like, oh, dude, don't even get me started.
I get fired up about it all the time. It's such a WTF situation.
Yeah.
You all knew that we were dying, suffering
Mhm.
from heart attacks. Heart attacks like the number one cause of death for women. And you never
Mhm.
thought to ask about the estrogen conversation. It was just,
Yep.
oh, here's a statin. Everyone benefits from a statin. This must be a statin deficiency. Like, what on earth? And
Yes.
how is
Yes.
that even still the conversation in 2025?
Here we
Still,
are.
it's appalling to me. I talk to people and
Yeah.
they're like, yeah, my cholesterol shot up. I've been put on a statin. I'm like,
Yeah. 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 And really, even this morning, so when I was looking through these papers this morning, I went into the research tool and said, all right, what is the first line of defense for the cardiometabolic risk for women at menopause? And it said, change your diet and lifestyle. And I thought, are you effing kidding me? This is
Yeah.
where we are. So
Correct.
we're still women who can't keep our mouths shut around food and we can't exercise enough. Give me a break. I get pretty fiery about this one, Dr. Gupta.
I agree. And literally that is the message. We're always told, work out more, eat less. It must be that you lack discipline. It must be that you lack consistency. It's like, do you know what we are? We're women. If there's ever a problem, we're the ones to call to fix it. Really, that's your answer, is that we're eating wrong? No, something changed.
Yes.
And we're trying to calibrate to that change while, by the way, we hold the entire planet up.
With our pelvic floors, no less.
Seriously.
Well, and it's true. And to me, it's a travesty that we have been excluded from the research up until very, very recently. So, any woman who has been through the metabolic shift that happens in our 40s, we know this is not about what we put in our mouths or not. Absolutely not. Because all of a sudden, the things that used to work for us no longer work anymore. And we're going, as you said, WTF, what is happening here?
Yeah. So will you speak into those other shifts that happen? I mean, there's a brain shift that to me is the most fascinating. Energy shift, sleep shift, cardiometabolic shift. I mean, will you kind of lay it on the audience for a moment in case someone in my audience has not heard me?
Complain. Okay, well, I think the first thing to understand is that menopause itself is the moment where you've been 12 months without a menstrual period. Okay, that's still the definition we use, and that about 10 years prior to that is a transitionary period we call either the menopause transition or perimenopause. In the medical literature, it's typically referred to as the menopause transition. Now, in that time, we have a brain rewiring that happens. And so that neurological shift starts to shift the other parts, the other systems. So we have the reproductive system is now stuttering or getting less regular. We have, as you said, the sleep system starts to be disrupted. The circadian rhythm starts to be disrupted. We have the musculoskeletal syndrome of menopause, which is the loss of muscle mass. It is the loss of bone. It is the loss of flexibility. We also have concerns with the intervertebral discs, tendons, and ligaments, and the loss of muscle stem cells. Now, as a chiropractor, I'm particularly excited about both brain and the musculoskeletal syndrome of menopause. But then we also have the genitourinary syndrome of menopause, which are the changes that happen to our reproductive organs, our bladder, our bowel, our vulva, all the tissues in this area, our pelvic floor, related to the estrogen loss. So typically what happens is in that 10-year shift we call perimenopause, we see progesterone goes low first. And we start to see the signs of that progesterone going low in the late 30s and early 40s. And this is how it shows up. And I can feel your ladies are getting ready to take some notes here. Check off some boxes here.
Thank you for explaining it so beautifully. Please.
Oh,
continue.
good.
You're
good.
doing
Yes.
such a great job.
Good. Okay. Well, thank you. I appreciate that. Because let's just be useful. Like, let's deliver the goods. Let's get granular on it. Let's get us advocating for ourselves and for the women in our communities who cannot advocate for themselves. I think that is such an important thing. Anyways, okay. Progesterone goes low, and all of a sudden we don't have the same quality of sleep. We wake in the night and we cannot get back to sleep easily. Okay. That is a sign of progesterone deficiency. And the solution to that is menopause hormone therapy, or HRT. Okay. MHT, menopause hormone therapy, is how it's typically referred to in the literature, depending on how old the medical paper is we're talking about. But HRT is a more common term. So we also tend to start to lose our testosterone towards the end of our 30s and early 40s. In the meantime, our estrogen at that time is going way up and way down and way up and way down. And we're riding this roller coaster going, I want to kill somebody. I don't want to be here anymore. Why am I feeling so crap? Like all of these things, which it is not a deficiency of estrogen problem at the beginning of perimenopause. It becomes that towards the end of perimenopause. And that's where I'm lingering myself right now at 52, teetering on the edge of calling myself menopausal. And what we know, again, and this is where we started this conversation, is that cardiometabolic risk really ratchets up at the place where I'm at. And we've got the cholesterol goes high, so the lipid profile is off. We have hypertension. We have a wider waist than we ever had. All of a sudden, the things that we used to do to help control our weight no longer work, and etc. So, by the way, I was going to mention one more thing with a to-do list. So if you're a woman in your late 30s and you have frozen shoulder, plantar fasciitis, or hip pain, I know, me too, called gluteal tendinopathy, that is the musculoskeletal syndrome of menopause. So make sure you're getting treated. Make sure you're seeing a therapeutic practitioner, whether it's a physio, a chiro, massage therapist, acupuncturist, whatever. Yes.
I have some questions.
Yeah. Okay. Hit me.
I feel like I need to be your neighbor, so I can come over for tea and be like, so Fiona, my life sucks.
Where do I start?
Can you help me, and can you treat me, and can you be my chiropractor? Can you put hands on me, please? Gosh, it's so rough. No one has these conversations. And you know what I find funny is no one talks about anything. So this last summer, this podcast could publish in 2026. So 2025 summer, I dealt with mold, and I dealt with acute hair loss. And I have talked about it on my podcast, so people know the volume of people who then texted me who were like, I have hair loss. What's working? What's not? I'm like, no one talks about their life problems. I'm the only weirdo who's like, I've had a fibroid. I had to get a surgery.
Yeah.
I had my boobs hanging past my waist and they gave me back pain. I had to get a reduction. That was like a 10-year decision because I'm so anti-surgery. So I am the only weird person that I know who openly shares. And I might not share everything, guys. Like there's some stuff I do keep personal, but 99% I'm sharing because I think we need to have the conversations. Yeah. So over the last year, I want to get into the Urogyne because, by the way, no one's talked about any issues there. So I don't even know what could be the issues in perimenopause, menopause that I don't know about. Yeah. But on the musculoskeletal, so many women get frozen shoulder, go to ortho. Ortho's probably like, I'll inject you. It's a cortisone injection. Here's some Celebrex and some NSAIDs for you. You'll be fine. Go to PT. And by the way, I really hate the go to PT answer. I'm always like, give me a better active solution that really gets me back into balance fast. Yeah. But I've had plantar fasciitis and hip pain for 2 years now. And the answer from ortho is like, I can inject you, or you can go to PT. And I'm always like, this is not a real solution. So will you explain that a little bit? And what was the third musculoskeletal issue you named?
Plantar fasciitis, frozen shoulder, and gluteal tendinopathy or hip pain. So you named all three. Or frozen shoulder, I think, was the one. Okay. So first thing I want to say is for anyone listening that wants to really get informed about the MSM or the musculoskeletal syndrome of menopause, there is an excellent paper written by Dr. Vonda Wright, who is the expert on this. Her book is called Unbreakable. The paper was published in July of 24. It's excellent. Like, Mine is dog-eared. It is highlighted in a bunch of different, because to me as a chiropractor, it explained what so many of my patients present with.
Got
And
it.
so the answer is absolutely staying flexible and making sure you're stretching and you're moving, and you've got your therapeutic practitioners, your somatic practitioners that can help you with that. But also, it is a sign of estrogen egress, meaning estrogen is leaving the system. And think of estrogen like a lubricator, no matter where it is, whether it's your mouth or your vagina or your joints, it works as a lubricator. And so if someone is suffering from the pain that goes along, the joint pain, by the way, knee pain is probably number 4 there.
Sure.
What, you too?
I don't have knee pain regularly, but as I'm sitting here, you know what? Here's what's interesting, Fiona. I am one of those people who I'm very in tune with my body. I'm obsessed with health, and I usually have to beg for something.
Ugh.
And I am watching and reading everything. So I begged for progesterone. I was told, nope, we need updated mammogram. We need annual mammograms from you after 40. I was like, you can go F yourself if you think that's what you're going to do to me for the next 45 years. No. I was like, this is why I go to functional medicine, because I cannot bear to be bossed around by people who have no understanding of what makes sense. That
couldn't be bothered to read their own research, is what you're saying. Yeah, go on. Sorry to interrupt.
So then I had to go find a whole separate doctor. I paid thousands of doctors for concierge level care on HRT. Finally, I got progesterone and I was like, fine, I feel better. Sleep is better. Everything's better. But now I'm begging for estrogen and everyone's like, you're fine. You're fine. What are you talking about? You're young. If you have an awareness around your body, I think the practitioners should start to listen to us. It's kind
100%.
of insane how we are not heard in this phase.
100%. Can you
histrionic and melodramatic? It's insane.
Absolutely. It's bananas. Can you imagine a man going to his doctor and saying, I cannot get an erection, and the doctor saying, it's fine, go have a massage, you should relax a little bit? Can you imagine? It would never happen.
Of course not. Men have problems, and there's entire pharmaceutical silos built around their issues. Men get testosterone and we don't. Can you imagine what we're doing right now? I can't wait 5 years from now when testosterone is no longer the BS that it is now for women.
Yep, absolutely. As somebody who takes all 3, I can tell you it is life-changing when you get those going, right? But even my own functional medicine practitioner, my nurse practitioner, kept pushing back on estrogen. She gave me the vaginal estrogen, which is great. But I said to her, the research is really, really clear that if I want protection of my bones, my brain, and my heart, then we want to start estrogen before the menstrual cycles have stopped. So my last menstrual period was just a few months ago. So we're here, babe. I do not want to wait for my heart to decline. I've got lots of heart stuff in my family. I also have neurodegenerative disease in my family. So I want to prevent those things from happening. It's now or never.
Correct.
So, but even then, I had to, as advocate for myself. And I think this is often where women find the gap is so many times I'll have women walk in this room and say, I don't want to be a bother to my doctor.
Yeah.
And, or he's too busy for that. And I'm like, hold on a second.
True.
I'm a doctor too. And this is our job. Come bother me. I'm here to make the quality of your life better and to make you more comfortable and to listen. And I think a lot of those things get missed in the actual traditional medicine training. Yeah. So I think that's changing. Yeah. And I think, there are people that are very aware. Certainly the menopause practitioners that are in traditional medicine in the United States are really starting to change, hopefully, how we're looking at from a doctor's perspective, how we're looking at the patient and paying attention. What I teach my doulas students are the first thing you want to do is just acknowledge the human in front of you who is suffering. Let her be seen. True. And let whatever needs to be told, be told. Hold it for her. Everything else is just is just glitter, The real meat is just acknowledging the woman in front of you.
Hi, I'm Dr. Shivani Gupta, and I created Fusionary Formulas because I believe everyone deserves a natural way to support their body's health. If you struggle with joint discomfort or stiffness, our turmeric gold delivers powerful curcumin in a form your body can truly absorb. It's science-backed with the highest quality ingredients and designed to support your body's natural inflammatory response. Take the next step in your health and wellness journey today. Visit fusionaryformulas.com and use code FusionaryHealth for 15% off. Fusionary Formulas, ancient wisdom, modern science, maximum impact. It's so true. I'm an Ayurvedic practitioner, so when people come to me, a lot of times I'm coaching. Like, can you go to your doctor and ask for this or things like that? And I've gotten to the point over the last decade where now when people find me, I go, you know what? I will give you my best functional medicine doctor, and I'm going to sit in on the call, and I want to be part of the conversation because I'm so sick of, oftentimes, if you haven't gone through this journey enough times now, you may not know the questions to ask. I was just on a call like that yesterday, and I love my functional medicine colleague, and I'll say, hey, I think it's this. And he'll keep consulting and asking, Dr. Shivani, what do you think? I'm like, well, have you looked at it from this angle, and this angle, and this angle, and this angle? Okay, now I feel like we actually serve the client.
Yeah.
And I can't do that with everybody, but I wish I could. I wish I could walk into every doctor's office with every sister and sister-in-law and woman in my life and participate on those calls, because I think maybe that's the next change we need is every woman who walks in to a doctor's office with perimenopause or menopause should take her best friend.
Oh, yeah.
Because your best friend will say for you what you will not say. I would sit in those offices and be like, do you know what she's dealing with? Do you know how gone her brain is? Yeah. We need help here, buddy. Let's go.
Yes. I love that idea. I think that's a fantastic idea. Well, and we advocate for other people in a different way than we advocate for ourselves. And I think that there are a lot of women who, our cultural conditioning is to stay quiet and unintrusive. I'm sorry, but that is not going to cut it when you are talking about getting care at menopause in the current medical environment we have. Now it's changing. Like I said, there are great doctors. I don't want to lambaste the doctors because for the most part, they're great, right? But if you get somebody like I tell this story a lot. So if I have any of my regular listeners, listening to this conversation, hopefully you've heard me say this before, but very famously, I had a patient in this room a few years back. She's well past menopause now, but I was in the phase of sort of gathering data on the people that I know and who is taking HRT and who is not. And she said to me, oh, I asked my doctor for estrogen. And you know what he said to me? I said, oh, do tell. She said, he told me, and I quote, "That's the bitch pill. Why would you want that?"
What?
I know. Isn't that stunning?
Stunning.
Yeah.
Stunningly ignorant.
Yeah.
Wow.
Yeah.
Wow.
Yeah.
We're living through crazy times. It's all going to change. What's great is, Fiona, you brought this up like way before it was the conversation, way before. So you're just OG. And isn't it's painful to be OG, but sometimes it can be fun. Like I know for a fact that in my lifetime, I will change orthopedic medicine, and they will say to every patient, this is my whole dream. When you have a patient walk in front of you who has aches, pains, and joint pain, you can use all your tools. I love orthopedics. They're awesome. And you could also say you can take turmeric for that. That's my whole thing. Doesn't have to be my turmeric. I honestly don't care. Give them good turmeric, get great result. That's a simple equation. And I'm confident that in my lifetime, we're going to see every doctor. And maybe I'm such an optimist, but I believe every doctor will finally understand that HRT was a huge debacle. It was a huge mess up of the epic kind. Mm-hmm. And we didn't serve women. Mm-hmm. And now we're going to quickly learn and study, because we as women have to keep pushing and demanding. We're going to quickly understand that we needed this support, and we're going to go retroactively give it to everybody. Like I literally just said to my mom, I'm coming to Houston. I will find you a menopause specialist. We are getting estrogen on board. I keep trying to get the doctors to listen. You can't get your doctor teams to listen. And she has concierge endocrinology and these things that I thought were good enough. Not good enough, apparently.
No, it seems to me that the endocrinologist, this is really sad to say, but the state of affair in endocrinology right now is diabetes and endocrine tumors, and that's it.
Yeah.
So if you're going to the hormone specialist and asking for HRT, that is not their wheelhouse.
No.
You go to the gynecologists by their own. It's not their wheelhouse either, because the research is reproductive medicine. It's obstetrics.
Yes.
And there was a number dropped recently. I'm trying to remember the details of it. Something like $450 million worth of medical research gets done in the United States every year, and less than 1% of that is for women over 40.
Yeah.
Right? So things are terribly, terribly, terribly behind. And the people that we hired, I know what I was going to say. Let me finish saying this. For the gynecologists who are supposed to be the women's healthcare specialists, by their own accounting, only 1 in 5 of them feels confident and trained enough in menopause, not even HRT, in menopause to discuss it with their patient. So there literally is left to women like me, women like you, who are not prescribers, to say, here's what we know. Here's what we can do. So I end up triaging menopausal concerns all the time. In fact, so much so that I created the Menopause Doula certification to train other women to do the thing that I do, because there's no diagnosing, there's no prescribing. So it's literally just acting as a menopause coach. You do it. I have done it for 20 years. I never expected to do it. I thought I was going to be a spinal health expert, but functional medicine took me another direction, I suppose. But you really have to be your own healthcare advocate. And this is especially true in menopause. And there is so much data now that we have, even in the last few years, that we didn't have.
Sure.
And something that I want to make mention of, because you've mentioned the Women's Health Initiative and how HRT went sideways. There were a lot of problems with that, which we know now. But I think the most important and most useful takeaway from that is that if you're going to use estrogen replacement therapy, you want topical estrogen replacement therapy. That bypasses the issues that the Women's Health Initiative talked about. So that is a gel, a cream, a patch. It gets absorbed through the skin. Bob's your uncle. So the other thing is the synthetic progesterone was the next problem. And so if you're going to be asking your doctor for progesterone, you want to ask for the bioidentical progesterone. In North America, that is called Prometrium. It is available by prescription. You can also have it compounded, and that's what you want to ask for. Now, there's several different ones for topical estrogen that you can leave that up to your practitioner. But if someone comes at you with a pill, you're like, hold up. Is this synthetic progesterone? No, thanks. I'll have something else. So there's layers, Shivani, of discomfort for women, especially if women have that conditioning. I never got that conditioning, to my mother's chagrin, to be quiet and mindful. I'm too much of a shit disturber. I came out that way.
Honestly, that's a good thing. We need more of that. I've actually always been very sweet and very quiet and well-behaved. I'm an eldest child, so I was raised in a certain way.
Yes.
And then we hit perimenopause, and I just want to cuss at everybody.
Yeah.
And throttle some people.
Yes.
And show up with menopause books and be like,
Gloves
I signed you up for menopause certification. The menopause, I don't know if the Menopause Society is the right place to study, but I signed you up for something and you need to be certified. And don't you dare tell my friends again at 45, birth control and an antidepressant. Because I swear.
Oh my God.
I get really passionate. Like, and what's interesting about what you said, think about it as a systems problem. Here we are as women from the integrative functional awareness space saying, you need to ask for X, Y, and Z. And you're pushing them at a system where 4 out of 5 people are going to say, you're fine. What are you talking about?
4 out of 5 specialists.
Yeah, 4 out of 5 specialists. So the one person you're supposed to go beg for help
Yes.
4 out of
Yeah.
5 will say no to you. So we're trying to jam towards a
Yeah.
1/5 as all of women in the West.
Crazy,
That
isn't it?
so effed up.
I know. I
That's an
know.
impossible situation. That won't work. Do you know,
Yeah.
like, I'm in the supplement space, so I talk to doctors a lot of my free time is spent there. And it got so hard. I don't even do that much anymore. I'm more in the online space because it's just so much easier to reach all women here.
Mhm.
But when I do talk to my doctors and take them out for breakfast and lunch, I'm like, you should sign up for menopause studies. You all need to go sign up. So I have this like agenda where I'm trying to
Perfect.
tell them all, please go get certified. Go get obesity medicine specialist certified. We all need
Yes.
help there,
Yes.
but in a way that's
Yes.
logical. And then
Yep.
go please help study menopause so you can actually prescribe, because we need more prescribers.
Oh, we absolutely do. I certainly looked at going back to school. It was about 10 years ago, I think. And my husband said, are you out of your mind? First of all, I can't, because I said to him, I said, it's either going to be, I'm going to go to school to be an RN and then a nurse practitioner so I can
Yes.
prescribe, or frankly, it would be quicker for me just to go through med school. He's like, do you think you want to do 24-hour shifts in the hospital, in the ER? I'm like, oh, hell no.
No, I don't.
That is a young person's game.
Yeah, I do. I don't know. It's a tough question. I'm so into medicine and health. I do wish I had an MD degree so more people would listen to me. And yet I think it's so important we don't put ourselves in the trainings that would shift our mindset. So for example, no one knows this, but I went to law school for 1 semester. And when I went to law school, I was like, this is not the place for me. This trains you to be risk averse. And I just want to go and like try everything in life. And I want to be open to how I do things. So I quit law school within a semester. I was like, I am never studying this. So amazing. I do feel like I chose the right system. I chose Ayurveda. But will you go back to the topic you were in, musculoskeletal syndrome? I have met Dr. Vonda Wright. I looked at her and I was like, you are ortho and a female. You're a unicorn.
Yes.
And she looks at me and I was like, I have worked with orthopedics for a decade. You are the 3rd female I've met out of thousands. She goes, I know, we're unusual. So I need to get her book and read it because I'm a huge believer in her work.
Yes.
And then you started talking about cardiometabolic and urogyne.
Yep.
Let's go into urogyne for a moment, because I know that there's some women who are talking about this in the space. But for our listener who might be like, yeah, stuff is changing, but I just assume this is all aging. Like, what are some of those symptoms that they could experience?
So we see a number of different things that are related to what's called now the genitourinary syndrome of menopause, or the GSM. And in fact, Dr. Wright named the musculoskeletal syndrome of menopause after that. So it's the GSM for the genitourinary system and the MSM for the musculoskeletal system. So the loss of estrogen to the pelvic organs and tissues is catastrophic in a lot of ways. It shows up like painful intercourse, like dry tissues that were formerly not dry. It shows up like irritation of the vulva and vagina and even the urethra. It shows up as urinary incontinence. That is peeing yourself a little bit when you get up from the chair, when you sneeze or you cough or you laugh. Sometimes it's a frequency or an urgency thing where, you pull into the driveway and your bladder goes, time to go. And you're not sure you can make it into the house to get to the toilet. By the way, the urinary incontinence piece cannot be overstated. It is a massive number of women. And if women are too embarrassed to talk to their doctor about hot flashes, do you think they're talking to their doctor about wetting their pants? No. The answer is no. It's not being discussed. But what I can tell you is that adding in an estrogen cream to the vaginal tissues, the vulvar tissues, so that is applying a compounded, there's prescription creams as well, to the outer tissues, can help with bladder incontinence, but also a great pelvic floor physio can do the same. There are countries on this planet that have pelvic floor physiotherapy care free for every woman at any age.
Wow.
Now that is progressive.
That's so evolved. Wow.
Isn't it? Isn't it though?
We need that pre-kids. We need it post-kids.
Absolutely.
But then even bringing that conversation into perimenopause, menopause is a big deal.
Well, and I think you and I are kind of floating in the perimenopause, early menopause era, but when we're talking the postmenopausal ladies,
Yeah.
bladder infections are a massive cause of mortality and morbidity for women. And the solution? Vaginal estrogen. It's inexpensive and it's accessible and it's not being prescribed. I know my mother went through this. She's passed now, but watching her, I mean, I just came across a picture of her the other day and I thought, oh, there was a bladder infection brewing. Like you could see it on her face. And the nurses the nurses in dementia care units are amazing human beings. They're like superheroes. They have perceptions that are far beyond anything you and I have. And they deal with that a lot of the time. But like, who is prescribing vaginal estrogen for the elderly and infirm?
Yeah.
Even though it could prevent their death and probably could have prevented them from having, because there is such a link between the bladder germs that go to the brain. Right. They go to the brain.
Like, bladder to gut to brain, of course.
Yes.
It's all connected. Gut is connected to it. Wow.
Yes. Yes. So urosepsis is what that is called. It's part of the GSM, and actually giving a woman when she has a bladder infection. Now, if she has an active infection and there's bacteria in the urinalysis, then you definitely want to treat the bacteria. But the long-term treatment is application of vaginal estrogen cream.
And didn't they just take the black box warning off that finally, so that we could finally, all doctors could safely recommend it?
Yes. And the thing is, this is a really, really good example of how the people that make the decisions in big pharma and the FDA, et cetera, are not even reading their own research. There was never any concern with topical estrogen applied vaginally or to the vulva with the risks that are typically associated with the black box warning. Somebody randomly made that decision, scared the shit out of doctors and their patients, and God knows how many women were denied care for something that could have easily been treated. It's shameful. It's shameful.
It's shameful. And it's still happening in front of us.
Yes.
Which is the insanity to me. For women like me to say, hey, I know that Indian women experience menopause earlier. I saw Dr. Mary Claire Haver, who said Asian women, Indian women can can experience menopause up to 8 years earlier. And I saw that and was like, oh, holy crap, I am Indian. Yeah. That could explain why I am saying louder and louder every year, hey guys, I need prevention on board. Please give it to me. And they're like, you're not ready. And I'm like, I'm just gonna have to doctor shop now and make this part of my part-time job to go find this solution, because the team in front of me doesn't listen properly. Like that, it's insane to me, honestly.
It really is. And I envision a time, hopefully not too long from now, as someone who's been talking about these things now for 20 years, where we no longer have to have these conversations, where every woman, whether she is Indian or not, is getting the care she needs. Why should any of those things matter? It's nuts.
I agree. And then will you explain the idea of post-menopausal? Oh, recently I said, oh my gosh, I need to get my mom estrogen. I thought she had it. She's not listening. The doctors aren't listening. And someone said, she's post-menopausal. She's done. And that drives me crazy. When people go, she's done?
She's done.
She's done mean? No, should we just put her on a shelf and assume she never requires any medical care until she's hospitalized because we've taken her to the nth degree of worst chronic diseases? Like, what is wrong with everybody that we call it done because we crossed the menopause line?
Absolutely not. So what I want to say about that is she's just getting started. She's not done. She's just getting started, because menopause is a wisdom transition. And so when we are no longer psychologically distracted by reproduction, now we get to step into our authentic selves. Right. However, in our culture, we don't value wisdom, nor are strong, empowered, resourced, wise women allowed to have center stage. Okay. Yes. What I'm saying there is It benefits a lot of people if we're sick and frail and demented.
Wow.
I know, right? So this is
Profound.
an act of rebellion.
Yeah.
I'm sorry, say that again.
It's a profound statement.
It is an act of rebellion. Self-care is an act of rebellion. And when you teach others, I teach my doula students this, when you teach others how to advocate for themselves and self-care for themselves, it is an act of rebellion against a system that has wanted to keep us weak, sick, broke, frail, demented, you name it. So I am a spicy Gen Xer, in case it's not really obvious. And I'm so grateful to my generation for being, we are allowed to be kind of bossy, right?
Yeah.
Not kind of, we're allowed to ask the difficult questions,
Sure.
right? We were raised in a way where we learned how to be independent early and fight for ourselves early. And I'm telling you, these personality traits from being a feisty Gen Xer are serving the menopausal ladies like crazy. So, but if you look at the women that are coming to the forefront of the menopause space now, we're all the Gen Xers going, not on my watch, sis, hold my Birkin, here we go.
Exactly. And I love it. I love watching it. I love the menopause conversation coming forward. I love that you created the first podcast on this. I love that you're creating a group of doulas and women to help doula us into this next moment of our lives, because it is a powerful moment. And it's one that should be acknowledged as a good thing. You know, we're talking about it like this is the worst thing ever. And I really think of it as it's just another transition. I became a mom. I'm not done being a mom, but they are teens. So I'm transitioning out of, a journey there, moving into a new phase. And post-menopause, like, why do we talk about that as being put out to pasture? Like, we're actually just, I'm not there yet, but you and that group are the wise women holding the space holding the wisdom that we all need in our lives every day. So,
absolutely. So what I tell my patients that are a little bit younger is, find yourself a Gen X sister that's already been through this, an auntie, a cousin, a friend, find somebody, because there is so much wisdom that gets distilled from having the experience of going through perimenopause. I am so excited about the changes I feel in my mental health, in my physical health in the last couple of years. I can't wait to put this whole reproduction thing down. And 40% of our lives is post-menopause. And you're going to tell me that's out to pasture? Whose idea is that? Hell no, not on my watch.
I agree. I totally agree. Dr. Fiona, Lovely, I could talk to you all day forever. I think you're just incredible. Thank you for this episode. It's been a breath of fresh air. I know we are coming up on time and you have patients to see. I need a part 2 to this conversation because we didn't even get fully into cardiometabolic, but I hope we really planted the seeds for everyone that these are huge shifts. We talked about 3 major categories, and we didn't even get to the brain shift. And there's just so much more here. And if you take one key message out of today, it's that you must advocate for yourself. And if you don't get the answer, guess what? You might need to go through 5 or 10 more doors until you find a human who will actually listen to you. But at least at first, get your advocate by your side. Whether it's a menopause doula, I love this idea of what you created, whether it's an auntie, a sister, a best friend. And maybe the first step is we all start taking someone in to our doctor's appointments to get that co-opinion on, are we getting the answer we need? Or are we being completely gaslighted and ignored in the space? And we need to go try again because we need better answers and we need to be served better. We need the tools and we need the resources. It's time.
Can you imagine if all women started showing up at their doctor's appointments with a bestie? I love this worldview you have. This is great.
Yeah. I'm going to go now. My bestie got served such bad answers. And when I heard after, I was like,
nope.
There's rarely an angry Shivani that comes out, but you hurt my people and she's here and ready. I'm ready. So thank you, Dr. Fiona Lovely. You have done such incredible work in the world. And I'm so excited to see what else you have in store for us in these upcoming years of amazingness of what you do.
Thank you.
Will you share where everyone can find you, where they can learn more about you, where they can find your podcast and keep growing and learning on this topic?
Absolutely. Thank you for asking. drlovely.com is the website. The podcast is called Not Your Mother's Menopause. And as we talked about, I've been doing it for 10 years. The Menopause Doula Council.com is where you can find information on the Menopause Doula certification. That information is also on drlovely.com. And that is I just have my first group enrolled in that. So that will be getting bigger and bigger. And it is my worldview that in the next 5 years, we really start to see those menopause doulas out in the world. They're so excited. I can't even tell you how excited they make me, because they're just like, most of them aren't even healthcare providers. They're just there to say, I'm that person anyways for my friends. So now I get to actually have the real training. So that's where you can find out about me and my work. Thank you for inviting me on the show. I've so enjoyed this conversation.
Thank you. Me too, Fiona. You are incredible. For everyone listening today, I hope you enjoyed this episode. Please share this with a woman you love, someone who needs to hear this wisdom and knowledge. To learn more about me and the podcast, you can visit shivanigupta.com. And I'll see you next week for the next episode. Thanks for joining me for this episode. Check out our sponsor, Fusionary Formulas, the potent turmeric supplement used by doctors around the U.S. for patients with pain and inflammation. www.fusionaryformulas.com. I'm your host, Dr. Shivani Gupta. For more, visit shivanigupta.com. Subscribe to this podcast in Spotify or Apple Podcasts. Click the follow button or subscribe in any of the apps that you use. That's all I've got for you on the Fusionary Health Podcast this week. You have the power to transform your health and achieve vibrant health starting today.